Hey, Digital Health Live, day one. We're here with Killu Sanborn, who's the Business Development Director for Oxford Finance.
Hello, happy to be here.
So I always love to hear about people's backgrounds and kind of where they come from college up to today. Give me a quick rundown of your career path.
Absolutely. I am actually originally from Estonia, which explains the name, and I came as an exchange student and went to graduate school then in Cornell Sloan Kettering in molecular biology. Wow. Got interested in biotech industry and went to work in the industry, and then shifted to venture capital and now venture debt. So have been on the funding track for the last 13 years or so.
Wow, wow. So we had this 360-degree panel on view of funding. What were kind of some takeaways and some hot spots that were discussed?
We were talking a lot about earlier stage funding, since that is particularly relevant to this emerging space. As digital health has a lot of companies that are figuring out what their business models are, a lot of cool technology trying to meet the needs of the healthcare, both the businesses as well as the consumers and customers, patients. But it's still not settled. It's still an industry that's trying to figure itself out. It's not very well set, and so there's a lot of early stage activity. A lot of conversation about angel funding, a lot of conversation about how to then graduate to the institutional funding levels of venture capital, and then beyond that venture debt. Because what we do in venture debt funding is we follow VCs into the deals, and for a lot of earlier stage companies we're really not an available source of capital until they institutionalize their capital base. However, we're very interested in the space. We have a few investments in our portfolio, and we're very much waiting for it to mature and become a revenue generating, real business, if you will, in terms of having figured out what the business is, how it runs, and who it sells to.
What really excites you about this space?
It's absolutely transformational. Now, there's been a lot of promise that it's transformational, and now you're starting to see that. And what's interesting to me, particularly being somewhat of an outlier in this space, is I don't come from direct healthcare. I come from biology, research, drug development, those kinds of different, very much longer cycle deals. It's very exciting to see how the fresh blood, if you will, from other industries is coming to change and transform what's possible in healthcare, and cutting through a lot of the business as usual, if you will, and at the same time shifting the balance of power, which hasn't happened yet, but which is already happening, to patients, to consumers, to the customers, and just sort of shifting the center of power, information, decision-making into different places where it hasn't been. So it becomes a little bit more distributed and a little bit more transparent. And the other thing that's very exciting is a definitely increased focus on health and wellness, which is very much an aspect of where business is already working in the digital health space. It is not something that I see in the medtech as usual quite as much. And I think that has the potential to revolutionize how people take care of themselves and their own health and take ownership of that.
Relationships run the world. How early do people should establish relationships with you?
As early as they think it makes sense. We just only can give them the capital when they have institutional backing and when there's enough enterprise value to make sure that we get paid back, since our instrument is debt. But it certainly is very helpful to establish relationships so we can monitor and watch the company as they build to plan and as they build to what they promise they will be building to, and see how that goes.
Okay. Well, sounds so good. So how do people connect up with you then?
Look us up on the web, oxfordfinance.com.
All right. Well, hey, thanks so much, and nice to meet you. And what are you looking forward to for the rest of the conference?
Things that are not obvious to me, things that will surprise me, and things that I will learn from. Right. I think there's lots of it here.
Cool. Hey, thanks so much. This is Tim with Digital Health Live, day one.